The risk is real. Mental health and litigation costs are rising. Affordable Care Act changes are making an impact on how we provide care. Other challenges have presented themselves at an alarming rate. Are you prepared to handle them? Do you have the programs in place to manage these risks? Providing effective health care for detainees is not a simple task. It takes problem solving, research, training, and compassion. It involves having preemptive programs in place that help you manage and lower your risk. It makes you dig beneath the surface to find the source of the problem, like mental health and drug addiction issues. It requires challenging the status quo and looking for ways to improve established practices. It means delivering the right care to the right person at the right time. And that's exactly what we do at Advanced Correctional Healthcare. Every day, we are challenged to think smarter, go further. We're problem solvers of the first order, experts in our field, and innovators in our approaches. In fact, we're often the first and best at what we do. Because of this, we're improving health, managing risk, reducing waste, and changing how people think about correctional healthcare.
The purpose of Advanced Correctional Healthcare is to solve problems for our patients and clients and make their lives easier. We can confidently say that over the last 13 years, we've done our job right. We've gone from a small startup company until today, when we work with over 250 correctional facilities in 17 states and care for more than 30,000 lives. Our program works. We're saving county jails thousands of valuable resource dollars by reducing waste in their systems. We train medical and jail staff on continued risk management techniques. We're making it easier to document healthcare records through our Detain EMR system. And we're doing it all while providing a higher standard of care. In fact, our data indicates your detainees will be healthier in your jail than they are when they go to their own doctors.
No matter what size of jail you run, ACH customizes its programs to your specific challenges.
Art Rose is my sales rep, if you want to call him that. I call him a friend more than that. But he came in, we are a small jail. I have 64 beds. But when Art came in and visited with me, you thought I had 600 beds. He came in and did a need assessment, what I need, what my jail staff needed, what our inmate population looked like. So, he really custom built a proposal that met my needs, and he listened to what I had to say. And he took that information and put a package together that has been almost to a T perfect for what my needs, because I've not had to make any adjustments at all with my inmate medical care. We're getting ready to go into our third year now, and we've made no adjustments at all as far as needs or services that's being provided.
Even though the care occurs in a jail setting, ACH wants to help patients improve and maintain their health, ultimately taking the stress and liability off your jail staff.
We went as far as having Dr. Johnson and Karen come down and give us the sales pitch. And it was strong enough for me that within about 10 minutes of talking with Dr. Johnson, let's get this started. It's what I was looking for. It took a lot of liability off my staff. It allowed our staff to get back to doing security procedures and things like that we really need to keep on and not worry as much as medical, because we're going to have nursing and we're going to have someone passing the medications, which is a big daily grind in a jail.
In this day and age, corrections has changed a lot due to litigation and stuff, and advanced healthcare is probably one of the front runners in staying on top of these changing issues.
Advanced correctional healthcare always tries to do the right thing. And they do that by making sure that we know that all of the detainees have the right to access to healthcare and have the doctor's orders followed.
You're covered from A to Z on this. There's nothing hidden. You're very helpful. They cover everything for us.
ACH provides your jail staff with continuous training and quality improvement opportunities.
The event today was pretty exciting compared to some of the other events that we go to here. Advance put on a real good program with Dr. Johnson speaking, and then with other experts from the company. They were able to give us good information.
Specifically today, what I've taken away and what I enjoyed about the day so far was listening to the instructors talk, listening to how they present the information, listening to how they care for us, and they care for, when it comes down to getting sued, they don't want that. They want to protect us, they want to help us.
24 hours a day, 7 days a week, ACH is available to take your call.
It's the customer service not only at the local level, but at the corporate level from Dr. Johnson. I mean, we have his own personal cell phone number. How many major corporations will give you the owner's personal cell phone number that if I need to call him at 2 a.m. on a Saturday morning, I have that ability if I choose to do that. That to me is an amazing step for customer service and to me in this day and age.
They're going to find out that they're very personable. They're not unattainable, and they're always at reach where you can talk to them. It's one thing good about the quality of the service that we get from these guys. We know we can call them at any time and get the help we need.
The proof is in our relationships. ACH customers value the services we provide, the techniques we train them on to help manage risk, and our commitment to quality assurance.
When you're in agreement with Advance, not only do they work with you to stay within your budget and to design a program that works, they have a tremendous amount of knowledge or experience in the field. They are willing to give you the training that you need. They are willing to work with you to ensure that your policies are correct and in order to keep you out of that liability that you're normally going to experience.
I did my research. I reached out to several sheriffs here in the state of Missouri, who were using advanced correctional health care. And I visited with them, how's the customer service, how was the doctors, how's the nursing protocols, and everybody told me that I talked to that they were 100% satisfied with the work that ACH was doing in their facilities.
When we look at our competitors, I think sometimes they're so concerned about maintaining business that they forget that in order to truly maintain your business and your partnership and your credibility with your clients, the sheriff's departments, for example, you have to do things correctly. And sometimes doing things correctly isn't the easy way. Doing things correctly isn't about cutting corners. I'm very, very proud of what ACH does because we want to make sure that we do what's right for our patients' health. And when we do that, that's going to serve our client by protecting them from risk. And that does set us apart from our competitors who may say they do all those things, but how they actually engage in that behavior doesn't match.
We're in the business of taking care of people. No one else is doing the type of work we do in a jail setting at the level of quality we achieve.
Join us in giving your jail the best health care you can provide. The training you will receive with Advanced Correctional Health Care is one of a kind. Even if you already have an established vendor at your site, give us a call and we can talk about training your staff with our proven method. Advanced Correctional Health Care, a higher standard delivered.